Hello, today we'll look at gestational diabetes and we are looking at lifestyle. So what can we do to prevent any problems with gestational diabetes? Because we have a problem already. We have a pregnant woman that is having a high glucose levels. This means gestational diabetes. And we can now give some advice on exercise, for example. What should this pregnant woman do? At least 150 minutes of exercise each week. That means 30 minutes per day. And it is good if the patient is having a good habit of doing it every day. Okay, 30 minutes every day. Of what? Stationary bicycling, walking, and for example, any strength training, but only with light weights. So these three things is more than enough, 150 minutes per week. Good. Then we have a diet. Diet, why is that important? Diet, we have DASH diet, for example, this dietary approaches to stop hypertension. This was composed to actually do that against hypertension, but it has been shown that this is very, very good diet. It has a very, very high compliance. This means that this pregnant woman will stick to this diet for a very long time. So not just a couple of weeks, they will eat healthy for a long time if they are eating a DASH diet. And DASH diet, what does this actually contain? It contains a lot of fruits, a lot of vegetables, whole grains, we have beans and nuts, we have seeds. Pregnant women should not drink alcohol, but the DASH diet can be good for normal people also, so therefore we recommend drinking 2 glasses of wines, but not for pregnant women. And then we have fish, we have poultry, we have low amount of dairy products and low amount of red meat. This is not the complete spectrum, but this is the main things that we have in DASH diet. We have another diet which is called a low glycemic index diet, but this diet is very similar actually. Also fruits, vegetable, whole grains, low amount of bread, a low amount of potatoes, and so on. Glycemic index is actually an index of showing how much carbohydrates do we actually have in this diet. Okay, but I will not go into the details here. The main message I have to you is that if you eat these things that I listed in these proportions, that we have a lot of fruits, a lot of vegetables, and then we have some whole grains and some seed, beans and nuts, and so all these other things that I mentioned, then you will be healthy. Eat not so much meat, but you can eat meat. You don't need to be vegetarian. You should eat meat, okay? There will be people who are vegetarians that will say, no, I will not eat meat. Fine, no problem. But the guidelines and the literature and all the research is saying that meat is not unhealthy if you're eating it in a low amount. So low amount of red meat, low amount of dairy products, and low amount of fish. Actually, fish can be eaten much, much more than other types of meats. The details are not so important. The main message, as we said, are fruits, vegetables. If you just stick to this and don't complicate lives too much, if you just stick to this, you will be healthy. Because people try to overcomplicate things. They try to measure things. Of course, I can tell you some percentages. You should eat 40% carbohydrate. You should eat 40% protein. You should eat 20% of fat. You should eat less than 7% of saturated fat. Okay, will this help you? Yeah, maybe if you start to calculate all this stuff in these proportions and you calculate all the food, and that is very, very cumbersome. It's very hard to make a meal every day with these statistics in mind. But it has been shown that it should be approximately like this. As we said, 40% carbohydrate, 40% protein, 20% fat. So we have less fat. Just remember the ratios at least. Fat is less. Proteins is much more. Double as fat. Carbohydrates is the same. Saturated fat that we have in, for example, meat is less than 7%. We can talk about grams also. What I'm saying is we can talk about all these things, but this will not help you in the end. The thing that will help you is that you remember, when I go to shop, then I eat a lot of fruits, then I eat a lot of vegetables, and then I eat some whole grains and all this other stuff. Okay? Good. Carbohydrates, for example, if you want to go into the details, 175 grams per day. We can tell it like that. Of course, it will depend on the body composition. If the woman is large, if the woman is small, you get the point. I can tell you that fiber should be 28 grams of fiber, for example, or 71 grams of proteins. But these are just some guidelines. You need to have at least these things. For example, kilocalories. You need to have at least 1,800 kilocalories and maximum 2,500 kilocalories per day. Which value is the most important here? Actually 1,800 kilocalories. Because if you go below 1,800 kilocalories, then you can get into something called ketosis. And that is something we want to prevent in a pregnant woman, ketosis. I will not go into details what ketosis is. You just have to remember that ketosis means that you are, for example, fasting, or you are eating less. Thereby the body tries to compensate this, and it will produce something called ketone bodies. And if you eat less than 1,800 kilocalories, then ketosis will happen. And this is not good for the pregnant woman. The other thing that can cause ketosis is, for example, if you're not eating proteins before bedtime. So if you're a pregnant woman, then please eat a protein meal before bedtime. And actually it has been shown that pregnant women should eat at least 6 times a day. 3 main meals, 3 snacks, and actually all the meals should contain some proteins. All the meals. And why? Protein. What will protein do? Improve satiety. That meaning you're feeling good. You're feeling satiety. You don't need to eat so much. So proteins is very good for increasing satiety. The other thing protein will do is that it will decrease the absorption of carbohydrate. Carbohydrate will be absorbed less. The other thing that we said, it prevents ketosis. So as you see, these are very important things when you're dealing with diet. We can go into all the specifics, but if you remember main rules here, please eat 6 times a day. 3 main meals, 3 snacks with a lot of DASH diet type, Mediterranean type of fruit, vegetables, and so on. Then you will be healthy. As we said about muscles and training, here, why do we actually do it? Because muscle increased, the mass that will increase when you train, will increase the insulin sensitivity. So imagine a muscle here that is increased in size, and that will increase the insulin sensitivity of the muscle cell. And thereby, if insulin will now act much better, then the glucose will be absorbed from the blood. And therefore, thereby, you have then less glucose in the blood. So these are the things that you need to remember, and I hope you will now appreciate DASH diet, and I hope you will also consider other diets that contain fruits and vegetables. But compliance is a very important key factor, because main problems with diets is that people are not sticking to the diet. One thing that is also important to talk about is BMI of a pregnant woman. If, for example, you have a BMI as a woman less than 18.5, which is very, very low, then you should actually eat around 35 kilocalories per kilogram per day. So you need to measure how many kilograms do I have. You take that times 35, and then you have approximately how much kilocalories you should eat. If you have 18.5 to 30 BMI, you know how we calculate BMI, I hope. BMI is that you take your actual weight, and then you divide that with the meter, so how tall you are, squared. So not in centimeters, meter squared, and that would be kilogram per meter squared. And that means if you have a BMI of 18.5 to 30, then you will be able to eat 30 kilocalories per kilogram per day. If you have 30 to 40, then you can eat 25. If you have above 40, then you have around 15. But as we said, the golden rule was at least 1,800 and until approximately 2,500 kilocalories per day to prevent ketosis. Okay, good. I thank you very much for listening. Bye-bye.